Hello, I'm Donald MacLaren, and I'm glad you can participate this way. I want to explain to you that I have been a survivor of colorectal cancer. There are expected to be 150,000 cases every year of colorectal cancer. And not only that, we have other types of cancers and other types of diseases. And for that reason, I'm after the fact that I experienced a miracle. And I want to share miracles with you and with anyone else. You can extend this video to everybody that you can so that we can share miracles and have 1 million participants of miracles. The miracles may be in health and may be in any other ways as well. But we want lives improved, and we ask God to help us. And just as many prayers went on my behalf, I believe I'm very much a living example of God's grace and love, because that's how miracles come about. Hello, I'm Don MacLaren, and thank God I can say I'm a cancer survivor in 2011. And part of my story is that by the grace of God, grace being His unlimited love, I have an opportunity to not only go on, but to do greater things. And this is part of what we want to show you, is a little bit of the surgery that involves my surviving cancer. It's called an ileostomy, and also part of the intestine shows, and it's called the stoma. Okay, that stops. Something. This is the cleaning of the stoma. A wet paper towel is necessary, and then it takes anywhere from 3 to 5 days to clean the stoma. The stoma, again, is the intestine of the ileum, the small intestine that protrudes through the belly or the abdomen. And this bag itself usually has to be drained approximately every 3 hours, more or less. But again, this is a life-saving surgery, and this is part of the process of getting past in my case, the colon, especially rectal cancer. Water is applied again to keep the stoma clean and the surrounding area. I heard of one case where a young girl in her 20s had severe problems with her colon, and they had to take out most of her colon, and she's living now with the bag the rest of her life. So the bag is a lifesaver, and it's only inconvenient as to when or where to drain it sometimes. Right now we're applying a skin protection that will protect the skin around the stoma with the adhesiveness of the bag. So we're protecting the skin so that it will help not to hurt the skin, but also for the bag to stay on. Now we're applying the bag around the stoma. It's the sticky part sticks right to the skin. We use a Q-tip to press around the stoma so there's no leakage. The waste material has a lot of acid in it, and it can actually burn the skin. So it's necessary to do the bag correctly. And again, 3 to 5 days the bag can stay on, as long as it's obviously drained several times a day. Now we're applying tape around the edge of the sticky part of the bag to secure it even firmer to the skin. Make sure it doesn't come loose or drop off. And we'll go all the way around with tape. But this is a lifesaver, and in some countries this ileostomy may not even be available, and so people cannot fight their cancer. I can thank God that I have the right doctors, the right surgeons. However, it's been a process. Before the surgery, I had to go through chemoradiation, which involved 28 sessions of radiation, and also chemo, which was for about 5 weeks, with a pump that had to be used every day. And now at times the there's no control of when the waste may come out of the stoma. However, there's no pain involved because there's no nerves with the stoma. It's just a matter of keeping it wrapped in the bag and also keeping it clean. Now this is to show that the bag, which is located on my right side, is not very noticeable at all, and maybe not at all. So a person who has a possibility of needing an ileostomy should certainly consider the bag and not give up on the opportunity to have surgery or save your life. In fact, I found out about the cancer through a colonoscopy. So I want to reach 1 million people. Tell you, go out there, get tested for any types of cancer, and try to save your life. You may be down. I was down for since April through September, just in radiation, chemo, recuperation, surgery, and then in September I have to go back for a reversal, and then there will be more recuperation. So maybe from April through December that I have had the surgery, chemo, radiation, and recuperation times. But this is certainly an example that people can live with a bag and have a life, and once all is done, you can go on to a greater life. And this is the grace of God, the love of God. Now, let me just come around here and talk about the other phases of my treatment. I'm using my t-shirt so that I can show you how the treatment began with chemo and radiation at the same time. They both lasted for 28 days. However, the surgeon had to place in here a little port or shunt where they put a needle, and then they taped the needle in place. And then I was given a purse-size mini computer that had the liquid chemo in it. And every 12 minutes, the chemo would be injected through the port here into my blood system. And again, this was rather convenient so that I did not have to go to the chemo doctor's office and sit there every day for hours and have the chemo that way. This way I could go through my general activities and take everything every 12 minutes, the chemo. And the radiation was done usually Monday to Friday. It was the first thing I did first of the treatment at the same time, and after I was finished the 15-minute dose of course, the radiation, I had to go to the once a week then to get the chemo replaced in terms of getting more. So this chemo radiation lasted for 28 days. So, And of course, even on the weekends, the chemo was still shooting every 12 minutes into my bloodstream. So it was a very aggressive and active type of therapy, but it was one of the stages. And then after I finished, I did lose 50 pounds. It's very difficult to go through these two together. And I had to wait two months. And then they began the surgery, which was to give me the colostomy bag and take out the cancer site. So it was very aggressive with chemo, radiation, and the surgery combined. So let me explain something else about the surgery. Now let me come around so we can focus on the situation for the colostomy bag. It was done here. The month of September they were able to, after 2 months of using the bag, they were able to go in and put my intestines together. They call it closed. So they closed the intestines. But the bag was my means of survival, staying alive for 2 months. After the surgery in the colon rectal area, then there needed to be 2 months of healing time. There is a degree of fat that remains in this area, but otherwise things are done. And the surgery of laparoscopy was involved in this area as well. And the intestines are simply in the matter of getting used to working normally. Otherwise they start out like a 2-year-old and they just are unpredictable sometimes. But thank God things are working, I'm alive, and this is the results of having God save my life at the right time. So let me go and explain something else to you. Now is the time to be able to hear from you as well. Please send me your stories, your prayer requests, and your generous support, because you are part of a miracle for someone else. One miracle leads to another miracle, that leads to another miracle, and the chain goes on of connections between us and God, and how we connect to each other as human beings and helping us in our spiritual growth. You can email me at faithintomiracles@gmail.com, and that happens to be the title of my book, Faith into Miracles. And your generous support of $10, $100, $1,000, or $100,000 will help others. We are doing international programs that will involve prayers and helping programs for the sick and needy, and these are all directed to helping others have miracles too. So we want to help 1 million viewers, but it's also your time to share the connection. So please share this site with everyone, and you could save someone's life, especially if they have cancer or an illness. It may be time to get the help and the medical help and the prayer help. So your miracles are coming as we pray for you, and your miracles are coming as you help us, because God sees your help and rewards you for helping. God bless you, and the address again will be given in the next segment. God bless you greatly.